A skull sits in a Peruvian museum, roughly 5,000 years old, and someone deliberately, carefully, cut a hole straight through the top of it. This is trepanation, the oldest known surgical procedure, and it appears on every inhabited continent, across dozens of cultures, spanning at least 10,000 years. The Inca site of Paracas alone yielded over 500 trepanned skulls. Some individuals had the procedure done 3 times. Archaeologists use 4 recognized techniques: scraping, cutting, drilling a ring of small holes, and grooving, all performed with stone or copper tools. No metal, no anesthesia, we can confirm. For years, the assumption was that most patients died. Then researchers looked closer at the bone itself. Smooth, rounded edges around the hole mean the patient lived long enough to heal. At Paracas, survival rates reached nearly 80% by the late pre-Columbian period. Ancient surgeons were learning, refining their approach over generations. Why do it at all? The evidence points to several reasons: head trauma from warfare, seizures, chronic headaches, and in some cases, ritual or spiritual transformation. In Neolithic France, at a site called Enzisheim, researchers found a skull dating to roughly 5,500 BCE. 2 trepanations, both healed. This person lived years after each procedure. Across the ancient world, trepanned skulls sometimes appear in graves with grave goods, objects of status. These patients may have been survivors revered for crossing a threshold no one else had crossed. What we called primitive surgery turns out to be a 10,000-year tradition of careful, evolving medical knowledge. The bone remembers. Subscribe and share for more like this 2 times daily.